Pediatric dentistry is the branch of dentistry dealing with children's oral pathology and is a fundamental basis to achieve a good oral health in adulthood because it promotes the dental health of children. One of the most important aspects in pediatric dentistry is the behavior management, because if our patients cooperate, the treatment will be of a better quality and will be more successful in a long-term period. When we are in front of the patient, our explanation should be done with understandable vocabulary according to patient's age. We can use substitutive words, such as familiar objects or situations, that will make our explanations more understandable to the patient. The most commonly used technique to manage the patient's behavior in pediatric dentistry is the tell, show, do technique. It is mainly based on explaining to the patient the treatment that we are going to carry out, the sensations that can be felt during the procedures, such as the rotary instrument's vibration, pressure, strength. Then we will show them the materials that are going to be used. And finally, we will carry out the procedure in the way we have explained and shown before. Among all treatments, tooth extraction is the one that generates more fear and negative charge on the patient's behavior. For this reason, it is very important to take into account all the considerations mentioned before when you are about to perform this treatment on a pediatric patient. Today, we are performing an extraction of this lower left temporary second molar. As it can be seen on the X-ray, the tooth has an advanced decay, and the patient refers a history of recurrent infections. For this reason, we have decided to remove it in order to allow the eruption of the permanent tooth. To extract temporary teeth, we need the same tools as in adults. However, we use smaller forceps because children's oral cavity is smaller. In this particular case, we have molar forceps, but we also have one for canines and another one for incisors. The elevators are the same as in adults. Topical anesthesia, which is commonly used in pediatric dentistry, allows us to decrease the discomfort of local anesthesia. We also use local anesthesia and a saline solution to clean the socket. We are performing an extraction of a second primary molar. First of all, we spread the topical anesthesia on the area where we are going to inject the local anesthesia.
Muy bien, Abril. Es para dormir un poquito todo el labio, ¿vale, Abril? Muy bien. Ahora estamos anestesiando la zona tópicamente. Sabe un poco mal esta crema, ¿eh? Vale. Ahora pasamos.
Now we are going to inject the local anesthesia through an inferior alveolar nerve block. Now I'm going to place a sleepy solution, and you'll notice a tiny pinch like a mosquito bite, but it doesn't hurt. Don't be scared. You should not move at the time I am placing the liquid. If you want, you can hold Maria's hands, and if you notice it is very cold, you can squeeze her hands and she will tell me to stop. Open your mouth bigger and close your eyes strongly, because we don't want to splash you around.
Muy bien, bien quieta, Abril. Vas a notar un mosquito pequeño. Muy bien, Abril.
Breathe deeply through your nose.
Pincha un poco la barriguita.
Now you will start to feel numbness at your
El
lips.
labio se pone gordo. ¿Notas un poco? ¿Sí? Vale. Vale, perfecto.
Now Maria is going to help you to rinse your mouth.
Saca todo el líquido que está un poco malo. Muy bien, Abril. Vale, dejamos que se duerma un poquito. ¿Notas cosquillitas por el labio? Vale, muy bien.
Next, we are going to luxate the tooth to detach the periodontal fibers. You will feel some strength, but not pain, only strength and pressure. Give me a finger and I will show you an example. I'm grabbing your finger and you can feel that I'm moving and squeezing it, but it does not hurt. And I will do the same with the tooth. Do not bother, it is just pressure.
Te lo toco un poquito, ¿eh? Toco un poco de fuerza, toco un poquito el diente.
Ahora empujamos un poquito.
¿Notas que se mueve un poco, Abril? Sí, ¿eh? Muy bien. Notas un poco de fuerza, ¿eh? Tengo mucha fuerza. Así, muy bien. Vale, Abril. Otra vez. ¿Bien? No molesta, ¿verdad que no? Es presión, ¿eh? Tira un poquito hacia mí, cabeza. Vale. Vale, ahora cogeremos el diente con unas...
Now we are going to remove the tooth with tweezers. If you hear a little noise, don't panic, nothing happens.
Que se me escapa, ¿vale? Notarás que muevo el diente, pero no tiene que hacer dolor. Vas a notar quizá un movimiento de fuerza, algún ruidito. Si escuchas algún ruido, no te asustes, no pasa nada, ¿vale? Empieza a mover el diente.
I begin to move your tooth, but it's only pressure.
¿Notas que se mueve? Pero no es dolor, es presión, ¿es solo? Muy bien.
Mucha fuerza.
Very good. That's all. We have done it so fast. Great.
Muy bien, Abril. Vamos a limpiar un
Now we can clean the socket with saline solution.
bien grande. Muy bien, Abril. Vas a morder una gafita ahora y ya estamos. Abre grande.
You have to bite this sterile gauze for a while.
Aquí, muerdes fuerte.
Well done.
Un ratito así apretando, ¿vale?